I'm Bishop Edward Weisenburger here in the Diocese of Tucson, and I'm visiting today with one of my favorite people, Dr. Anna Sanguineti. She's a volunteer here in our diocese who especially helps us in leadership with our life issues. And so I thought, with the Dobbs Supreme Court decision having come out, there seems to be so much information in the media, and a lot of it, I must admit, a question. In fact, some of it I know is incorrect. But Dr. Sanguineti, tell us briefly about your background.
Thank you, Bishop Weisenburger, and thank you for inviting me to talk with you about this important topic. My background consists of a medical education. Actually, I was first a physician assistant for years in practice outside of the United States. I then entered medical school here at the University of Arizona, and I have been practicing for the past 30 years as an internist.
And I believe you're married to a physician?
I am married to a pediatrician.
Oh, a pediatrician.
We have many medical discussions over the dinner table.
And don't you also work some at the medical school?
I did, yes.
Okay.
I'm recently retired, but I was an associate professor there, and I taught the residents in medicine.
Oh, very good. I fear that sometimes what's put forth in the media is that our religion is distinct from the science, or that the two are in conflict. And that's never been my understanding, but it seems to be presented that way, almost as though Catholics are kind of mindless and are supposed to just swallow the pill of the teachings of the Church without using their brains. And yet I find we really need Catholics to use their brains, because I sense our teaching that life begins at conception seems to be mirrored by the science. Can you respond to that?
Well, I'll tell you, I think the Catholic Church is very wise in its teaching, and I think there's a beautiful unity between church teaching and what is scientific truth.
Well, was there ever a time in your training that you questioned if life begins at conception?
From the very beginning of our medical school training, we study embryology. We also take the Hippocratic Oath that says, first and foremost, do no harm to a patient. And we're called upon and taught to treat patients, treat them with compassionate care, and try to avoid hurting them or making their condition worse. With regard to embryology, in our studies, it says very clearly in our book that life begins at conception, which is actually defined as the union of a sperm and an egg that results in fertilization. A new life emerges at that point. It's something unique and different from any previous life. And so with that firm scientific background, it would be hard to question that premise that life begins at conception.
Okay. We keep hearing abortion associated with health care. Do you equate abortion services with health care? I've always wondered. I've wanted to ask a doctor that for a long time.
Abortion advocates do promote that particular thought, saying that abortion is necessary to a woman's health care, but in truth, that couldn't be further from the truth, because in a woman's reproductive years, there is no need for her ever to encounter or to have an abortion. It doesn't promote her health, it doesn't improve her health, and the lack of any abortion care is certainly not something that she's going to miss. From the other side, with regard to physicians, this really is a marginal practice. The majority of OB/GYN doctors do not even perform abortions. As a matter of fact, there was data from a study in 2013-2014 that showed that less than 15% of OB/GYN doctors had even performed an abortion in those previous 2 years.
Wow.
Currently, data shows that between 10 and 20% at most have anything to do with abortion.
So I've heard that before and I've seen the statistic, but I guess the vast majority of physicians won't have anything to do with abortion.
That is right. They don't encounter it in their practice, or if they do encounter it, they don't actually perform the abortions or have anything else to do with it.
I have a sister who has spent almost 30 years as a nurse practitioner in neonatology. She's an expert in taking care of those tiny premature babies. I've visited her unit many times.
Tiny.
And as a woman of great science, I think like you, but also a woman of great faith, it crushes her heart to think that babies so much further along than the ones she's taking care of are having their lives brought to a close.
Yes, and it's sad because it's really a lot of misinformation that is promoted and takes advantage of vulnerable women.
Well, now, speaking of vulnerable women, that is a very important topic to us because, in fact, the church has been criticized that we care about unborn babies, but we don't care about mothers, which I don't agree with. I think we care deeply and actually put a lot of resources and efforts into that. But what's been your experience in the past with any crisis pregnancies? I know you've done some work with some local organizations. Tell us quickly about that.
Well, I'll tell you, women do find themselves in challenging situations.
Certainly, yes.
With an unplanned pregnancy, especially if they lack the support system to help them through that. I do remember about a decade ago I was working at Reach Out Pregnancy Center as a volunteer.
And Reach Out is here in Tucson.
Reach Out is here in Tucson.
Great place. Yeah.
Offers limited medical services that are free to a woman who's pregnant, such as free pregnancy testing, ultrasound, counseling, and even limited STI testing, which is sexually transmitted diseases. So at any event, a teenager came into our office one day. She was a junior in high school, and she had just discovered that she was pregnant. She was in a lot of distress, and this was because she had told her father about it, and he had kicked her out of the house. So she had no place to go. In addition, her boyfriend had abandoned her once she found out that she was pregnant, and he had moved on. So she came to us looking for some help. She was very undecided in how to proceed. Obviously, abortion was on her mind. And we did perform an ultrasound and showed her the beating heart of her baby, which was a transformation for her. At that point, she decided that, no, she did want to have the baby, but she didn't know how she was going to proceed. So we jumped on this to help her out. She brought in the mother of the boyfriend, who committed at that point to helping her continue her studies and promised to take care of the child through her high school years, which I thought was a wonderful commitment on the part of the mother. And then we found a place for the woman to stay while she continued her studies, and we got her into the school that they have here in Tucson for teenagers that find themselves pregnant but need to continue with their high school education.
So there was some follow-up in her case.
Definitely. We followed her throughout the whole 9 months of her pregnancy, and I was there in the hospital with her when she did deliver her baby.
Oh, wow.
Yeah, okay. It was wonderful, and it was wonderful seeing her, how happy she was. I mean, it was a complete difference from what you might see if someone had elected to end the life of their child. It would have made a bad situation worse. Her father did ultimately accept her back into the home, and the last I saw of her and the grandmother was when I went to visit the baby in the grandmother's home. She had a crib, she had everything set up to take care of the child, and she had continued with her promise to help out.
Wow. Wow.
It was a wonderful ending to a very distressing start for that woman.
Right, right. Now the church, I think, is getting more and more involved, and I'm really pleased and excited about it with this program from the United States Conference of Catholic Bishops encouraging all dioceses. It's called Walking with moms in need, that's right. And I know you've been going around our diocese, visiting in different regions, talking to our pastors about it, and it's starting to take root in some places. Tell us just real quickly about that program that we're offering.
Well, I think it's wonderful that the bishops promoted and developed this initiative. It is designed to be carried out in the parishes, all the parishes throughout the United States. And it calls on parishioners of each community to look around and to see the women, the young women that find themselves unexpectedly pregnant and find themselves with some challenges and struggles in that pregnancy, whether it be financial, material, spiritual, or emotional. And the Church calls on us to accompany them in their journey, to help them out, and to communicate to them the resources that are available in the community and direct them to those resources so that they receive the assistance they need.
That's one of the things I really like about the program is it begins by not trying to replicate what others are already doing. We don't need two people doing the same thing. So it looks at what services already exist and then where are the gaps? And then you put your efforts, your energy, and your resources in
and
those
that
areas.
was an important part of our first efforts, was looking at all the resources, and it was amazing to me the number of resources I didn't know that existed. Adoption options, prenatal care, mentoring, education for young parents, all of these things that benefit the women no matter what circumstance they find themselves in. And I think it's an affirmation of the culture of life, too, to develop that culture within our communities.
I do, too. Doctor, this has been so helpful. I think you bring a clarity to some of these issues. Sometimes we need to hear from someone with the science background who, building upon that, is also a person of faith. In fact, that ancient belief that's so incorrect in the world that people of science are somehow in conflict with faith. I've also read that there are more doctors who are believers in God than there are doctors who do not believe in God. So to have a good physician, a good person of science here, but also a woman of great faith, it's very helpful. You've given us clarity. Will you come back and talk to me again?
I would love to,
Good,
Bishop.
because the next time we talk, maybe we can briefly get into some of those more technical issues, like maybe ectopic pregnancies or things of that nature.
Yes, medical conditions that impact a woman's health during her pregnancy, definitely. Thank you so much for inviting me, Bishop
You bet.
Weisenburger.
It's been a blessing. God bless.